This is Dr. Martin. Today we're talking with Erica. She is our amazing morning co-op, and she's going to be talking today about epilepsy. Go.
Okay. So epilepsy is a neurological condition that affects the nerve cells in your brain. And epilepsy is also known as a seizure disorder because people with epilepsy oftentimes have seizures. So 1 in 26 people will actually develop epilepsy throughout their lifetime, which is a really big and large number of people. So a seizure is caused by chemical changes that occur within the nerve cells in your brain. So this happens when there is too much activity in those nerve cells, or there's too little activity in those nerve cells, and it causes an imbalance. There's not that happy medium where your brain can operate smoothly. So this imbalance causes electrical surges, which causes a seizure. So epilepsy can develop in any person at any age throughout their whole life. So it's not one of those conditions where, hey, I made it to 40, I'm never going to have epilepsy. No, this can occur in a 2-month-old baby or an 86-year-old grandparent. It can affect anyone. And there's over 3.4 million people in the United States that have epilepsy. Okay. There are some symptoms that can tell whether or not you're going to have a seizure. And this includes feelings of fear or panic. You could have some visual loss that goes along with those seizures. You could become really dizzy or lightheaded. And you could also experience some really bad headaches before a seizure. And seizures can occur on their own, but there are some triggers that you want to stay away from that can cause a seizure. And this includes flashing bright lights such as a strobe light. Alcohol or drug use can also induce a seizure. And let's see. Low blood sugar can also cause a seizure in epilepsy patients. That's why oftentimes people with epilepsy carry candy or sugar on them in case they're feeling kind of funky to try and get back into their normal routine. And stress and sleep deprivation can also cause a seizure. Okay, so if you have had a seizure, you definitely want to go and see your primary care doctor and tell them what happened before the seizure, during the seizure, after the seizure, and overall how you are feeling. And if they think you might have epilepsy, they might refer you to a neurologist who would run special testing to see what is actually going on. So this could include a CT scan or possibly an MRI. And there are a couple treatment options for epilepsy. This includes seizure medications such as gabapentin, and these seizure medications actually really help the patients, and there's a wide range of the medications. So it's not one size fits all. You can try a medication, and if it doesn't fit for you, they can switch you to a different one, and it's really trial and error to see which medication fits you and your seizures. And there's also a surgery option for people with epilepsy whose seizures always occur in the same spot. So say your seizure is always occurring in the back right side of your brain right here. If they can track that and see that it's always occurring there, they can open the skull and actually remove the part of the brain where the seizures are occurring. Very invasive approach.
Wow.
Kind of scary, right?
That's kind of heavy.
Yeah. So this doesn't work for patients whose seizures are occurring in the front of your brain and then the back of your brain. It always has to occur in the same spot for the surgery option. Okay. So there are a couple things that you can do if someone is having a seizure. First of all, you want to roll that person gently onto one side and support their head with your hands so they can't thrash around and get a concussion. You also want to protect their limbs from injury so they can't hit somebody or run into something. And lastly, you want to make sure that their breathing is occurring at a steady rate. And also, I used to be told that you always want to shove something into their mouth so they can't swallow their tongue or choke on it. And Epilepsy Foundation is actually saying that you don't want to do that because you can break their jaw, dislocate it, and it's actually physically impossible to swallow your tongue. And then lastly, I just have a couple of quick facts about epilepsy. So epilepsy can't be cured with medication, but it can be successfully treated. And you're probably wondering, what does this mean? These words are like the same. So epilepsy can be successfully treated in the way that you might not have seizures for a while, but it's not 100% guaranteed that you won't have a seizure again. And there are more people with epilepsy in the world than there are with autism syndrome, Parkinson's disease, multiple sclerosis, and cerebral palsy combined. There's over 65 million people in the world who live and deal with epilepsy day in and day out.
Wow.
And that is epilepsy for all of you. If you guys have any questions, feel free to stop by in the mornings when I'm here and ask me a couple questions about epilepsy.